Why are people not getting the message about antibiotics, and why are some doctors not getting it too?
Well, it's a combination of factors. I think that we're sort of turning into a nation of people who want a pill for every ill and who don't really do, I suppose, the same as our grandparents' generation did, which was, actually deal with coughs and colds by just, seeing it through and using sort of conservative measures to make themselves feel better. I think, it's a shame that there's a lot of pressure on doctors to prescribe antibiotics, but, it's also a case of trying to explain to patients why they shouldn't be having antibiotics, and that's the hard part, because some people still think that we're trying to be mean for some reason, rather than understanding that actually for lots of things, viral illnesses, antibiotics won't make any difference.
You must have had some tricky situations when a patient has just insisted.
Absolutely, and it's usually because they'll have a condition, most commonly something like a cough that's gone on for more than a week, therefore I must need antibiotics for it. In some instances that may be the case, but we need to examine those patients and see whether they really do fit the criteria to have antibiotics. Otherwise, we're going to end up with all the side effects of having a drug that is being used inappropriately.
Well, let's spell out what that leads to, because the more they're overused and used incorrectly, then the less effective they become, and we get then diseases like MRSA, which are resistant to antibiotics.
Precisely. This is the problem. We're getting more and more resistance to all the usual antibiotics that we've always used in medicine, and we're not really getting new antibiotics coming out, and the ones that we do have, the sort of domestos type antibiotics which we reserve for those resistant bugs, are now finding bugs that are resistant to those as well. So we're just kind of, it's a dwindling thing, and part of it is other things as well, like people overseas, of course, who can get get their antibiotics without prescription. And that's certainly an inappropriate usage of those medications.
Monah, many thanks. Good to see you.
Likewise.